So then, what do you make of the US healthcare system today? Think about your own personal experience with it. Have you been able to get medical care when you needed it? Have you had to think twice because of the cost? Have you struggled to even have coverage? Ultimately, this normative question is best answered through an assessment or an evaluation of the US healthcare system. To do this, we'll consider using the big three E's: effectiveness, efficiency, and equity. When we set criteria to assess the United States healthcare system, we need to consider the unit of analysis. What are we comparing the US system to? Do we consider the US healthcare system versus all other countries' healthcare systems? No. Typically, we consider the US versus other developed countries. Why do we do this? Well, to properly assess our own system, we have to be able to compare it or measure it against something else. We want to compare apples to apples here. Thus, developed countries, or industrialized countries, are sovereign states that have a developed economy and advanced technological infrastructure relative to other less industrialized nations. Thus, the US versus other developed countries, we're all on the same playing field. Okay, now that that's out of the way, let's think about effectiveness. Well, to start, we have to understand what are the goals of the US health policy. We tend to think of the US healthcare goals as almost three things. First, we want to maximize the quality of healthcare available. Second, we want to minimize total national expenditures on healthcare. And third, we want to achieve equitable distribution of the benefits of quality healthcare and the burden of cost. These three goals line up pretty nicely with these three evaluative criteria we're going to examine. Well, first, we want to maximize the quality of healthcare available. The United States has some of the best healthcare treatments available in the world because we lead the world in medical innovation. US health R&D is thought of as being almost second to none. However, we tend to be really good at treating certain diseases compared to other countries. We're really good at kidney transplants, breast cancer, and common cancers, as well as ALS. And we're getting better at treating heart disease. However, why are we good at these certain diseases? Well, typically, these diseases are the ones with large campaigns, awareness, and they have a lot of funding and research attached to them. So then, how do we know if the US healthcare system is effective? Well, it depends how we operationalize effectiveness. What measures will we use? Well, in some measures, we are really good or really effective when it comes to our healthcare system. Yet for other measures, we lag behind other countries. Take, for example, infant mortality or life expectancy. So then, if the US healthcare system is effective on certain measures, then is it also efficient? Basically, do we get the biggest bang for our buck? This is where things get to go a little bit south for the United States. Across a variety of measures, our healthcare system tends not to be viewed as very efficient. When you think about how much we spend on healthcare in the world, about 17.8%, we're spending more of our GDP than any other developed country in the world. And yet, if we're spending that much money, is the quality or the outcomes of healthcare equivalent? No, most people tend to view healthcare in the United States as being fairly mediocre. For the past 50 plus years, Americans with health insurance have rated the system poorly to fair. Further, in terms of where we're spending our money, 75% of the dollars we spend on healthcare are spent on preventable diseases like cancer and diabetes. And this is the treatment of those diseases, not the prevention. Finally, we spend an excessive amount of money on administrative costs, not actually care. Yet what's interesting is when you consider where this money is being spent on administrative costs, your mind typically would go to potentially government-provided healthcare like Medicare or Medicaid. Yet actually, these plans have some of the lowest amount of money spent on administrative costs. Actually, private companies have the largest amount of overhead. Medicare and Medicaid only have 5 to 6% of the money spent on administrative costs. Yet, small and large employer-based plans typically have 15 to 30+% of the funds spent on administrative costs. Taken together across a variety of measures, the US healthcare system is not very efficient. Finally, the United States healthcare system tends to struggle with equity as well. One of the perennial concerns is the number of uninsured individuals in the country. Before the Affordable Care Act was put in place, around 50 million Americans were considered uninsured, basically 16% of the US population. Compared to other industrialized countries in the world, we're the only one without universal coverage. The idea of universal coverage means that all citizens have access to preventative, curative, rehabilitative, and palliative care. Why is this the case? Because of our two-tiered system of health insurance, this pluralistic system. This doesn't create problems with the quality of care, it creates problems with access to care. Basically, those with a job or have access to some form of government health care actually have access to government and public provided health insurance. Those without a job or those that are ineligible for these plans thus don't have access to health insurance. And because of the way the plans are structured, typically with employment-based health insurance, most individuals could face bankruptcy if an illness strikes. This is more likely among low-income and elderly populations. A report from the Federal Reserve Board, remember, the Fed, reported that 4 in 10 Americans can't cover an unexpected $400 expense. And given the rise in the cost of health insurance, $400 could be a drop in the bucket. The Affordable Care Act, instituted in 2009, was heavily focused on resolving these equity issues. And ultimately, when you look at the number of uninsured Americans pre- and post-ACA, it did a fairly good job at lowering that number. Remember, before the ACA was instituted, there were around 50 million uninsured Americans. Today, that number was cut almost in half.